that there were 10 participants on the phone. So.
Yes, I think we're up to 13 now.
Oh, okay. Able to see something that I can't see yet.
No, I'm just counting the beeps.
Oh, okay.
Would you like to begin?
Yeah, why don't we? It is 4 o'clock. Okay.
So those that are on the phone, please mute your phone.
Ron Klein, I'm here.
Thanks, Dr. Klein.
Somebody.
Yeah, this is Ron Klein. I'm sorry, I can't hear very well.
So
I can't hear either because somebody's talking.
I'm going to put myself on mute, but I'm here.
Okay, thanks. John, if we hang up and make everybody call back in.
that person, no, that person will still be on. So at the next meeting, we are going to have a separate call-in number or a separate access number for board members, so we can mute everybody until public comment. I apologize for not having that set up already. We'll make sure that's done at the next meeting.
Okay. Well, whoever it was probably realizes now that their conversation was feeding over the phone line. So with that, I am going to call our meeting to order today. This is our telephone conference where John updates the exchange on any Assembly, Senate bills, or bill drafts that mention the exchange, or any bill drafts or that might have an impact either financially or otherwise on the health insurance exchange. So with that, John, I want to welcome everyone. We will have public comment, and I'll limit that to minutes. We do need to sign off on the line by 5 o'clock. And for those individuals that are joining the phone conference, can I ask you to mute your phones because we pick up any conversation you have, typing of keys on a keyboard, anything that's happening in the background there. Then, John, I'm going to ask you to take the roll call, please.
Yes, Madam Chair. Yes, just to add on to that, please mute your phones. Please do not put us on hold. So whoever's on the line, please mute your phones. We can hear every word that you're saying.
John, this is Ron Klein. I'm going to mute myself, but I am here.
All right, Mr. Klein, Dr. Klein is here. Ms. Johnstone is absent. Ms. Lewis is absent. Dr. Klein is here. Ms. Kerr?
Here.
Dr. Ford?
This is Dr. Ford. I am here. I'm muting my phone.
Director Wilden? Commissioner Kipper? Director Mullenkamp? Ms. Edkins indicated she would not be attending, and Chair Campbell.
Present.
And we have a quorum with Chair Campbell, Dr. Klein, Ms. Kerr, and Dr. Ford present on the phone.
Okay. Thank you, John. I'm going to open it up for public comment. Is there anyone on the phone line that would like to participate in public comment? Doesn't sound like it. So, and we will have public comment again at the end of the agenda. So, John, do you want to take us through some of these bills that make reference to the health insurance exchange?
Absolutely. And some of them are reference to the exchange itself. Some of them are administration of state agencies, and some of them are related to health insurance. So there's a whole concoction of bills here that we're going to go through. Expect the list to expand considerably. There were about 180 bills that were introduced this week, and hopefully very few of them impact the exchange, but we've already noted a few of them, so we will get to those at the next meeting. First on the list is on page 2, Assembly Bill 65, which revises various provisions relating to open meetings. There's been no change since the board last discussed this. The board's position was to not take a position and to monitor for amendments. And unless there are any questions, then I will continue on to AB 220.
Do any of the board members have questions? Okay, move on to 220.
Assembly Bill 220 on page 3 prohibits certain fees relating to credit card transactions. It prohibits surcharges for the use of credit cards. So as an example, the local donut shop here, if you use your credit card, they charge a 50-cent fee or a 25-cent fee on the purchase. If you, in the future, if you were to use your credit card, if this bill were to be passed, they would no longer be able to charge that fee. They would have to charge the same rate for every customer regardless of the payment method. The exchange had contemplated using a Visa and MasterCard credit cards, which have merchant fees of approximately 1.75%. However, we should note that that merchant fee would be on the total premium, not just the exchange fee. So if we were to need to absorb that fee, we would expect potentially a 10 to 15% increase in the fees that we charge to the carriers. Additionally, we estimate that AB 220, if we move from what we expect to do of charging a fee or a convenience fee to not charging a convenience fee, we would expect a change in utilization from about 10% to 25%. Those are very rough guesses based on some other state agencies, but that's kind of what we're guessing at right now. So based on that increase in utilization, we have submitted a fiscal note. You can see that information at the top, about $500,000 in the first year, about $1.3 million in the second year, and about $3.4 million in future biennia. It would obviously increase the per member per month fees in the long term, so we have to be aware of that. I think we're still below the 3.5% of premium, so that's good news that the 3.5% target that that is the federally facilitated exchange fee. We will probably bring back to the board at the next meeting a discussion about how we want to go forward with the credit card fees. We have to discuss it internally. We're not sure if it's going to be this month or next month, but coming soon. How exactly we go about doing that, we want to make sure we have a good public discussion on that. So staff's concerns is that AB 220 will cause an increase in credit card utilization, and that the exchange will either need to not accept credit cards or increase the estimated per member per month fee charged to insurers beginning in 2015. There's one additional option, which is to pass that charge through to the carriers for the specific transaction. We're not sure exactly what is the appropriate way to go about this. I would also like to point out that there is another bill that that requires that agencies that use credit cards charge a $2 convenience fee. So that is in direct conflict with this bill. So I'm not sure which one will go forward. We will bring back that one at the next meeting. Again, all of these bills came out in the last several days after this meeting was agendized. The recommendation is to direct staff regarding the board's position and message to the legislature regarding AB 220. I will also like to point out that on page 11 there is a summary of each of the bills. So the bill number, summary information, fiscal impact, the status of the bill, where it's at in the legislative process, the board's position, and then comments from the board and from staff. So you can see that one first on the list underneath staff comments. With that, I'll be happy to take any questions.
Do we have any questions? Okay, then let's move on to the next one, John.
All right, moving on to AB 251 at the bottom of page 3 and then on to page 4, requires disclosure to the public of certain contact information for members of public bodies, and that includes the exchange board. Basically what it says is that if you have provided your contact information, specifically it talks about phone numbers and email addresses, if you've provided that information to us, then we are required to provide that to a member of the public who asks for it. I'm not positive, but I think that is already a requirement in the public records. If somebody does a public records request for that information, I think we'd be required to provide it. I think this bill maybe streamlines that process a little bit, but I think the requirements are the same. And maybe Mr. Belcourt can provide some illumination for us on the public records request. If a board member has given us their phone number and email address, and somebody makes a public records request, are we required to provide it?
Well, this amends an existing statute which provides that telephone numbers given by the public to or other people dealing with boards and commissions and that are put on a database are confidential. And this would, I'm not sure if there's deemed to be an ambiguity in existing law whether that particular database includes board members themselves giving their contact information to the public body, and whether that comes within the database. This would take it outside the scope of that database, assuming confidentiality, assuming that's the current law. So at the very least, it's making it crystal clear that the contact information would be a public record henceforward.
So at the Assembly Committee on Government Affairs on March 18th, there was a discussion about allowing public bodies to have email addresses or phone numbers specifically for the public body so that no personal information is provided. So as an example, we could give each of you an email address that's exchange.nv.gov, and so that way your personal or work email address would not be subject to that. The other way to do, additionally, we could provide each of you exchange cell phones. So if somebody wanted to contact you, that would be available. The bill, I think, provides that the contact information is available during work hours. There was some question about whether or not it's appropriate to call board members during work hours. And then there was also a question about concerns about, if I'm a board member now and don't want to do this and want to have a public email or phone number or an exchange-specific phone number or email address, can we have an effective date that's in the future that allows us to redact or pull out any personal contact information? And again, that's not just for the exchange, but for any board. I think it applied to everybody, boards and commissions and the legislature. The only ones it did not apply to were elected officials such as the governor, secretary of state, attorney general, lieutenant governor, and the controller. I think I've got all of them in there. So with that, our recommendation is to direct staff regarding the board's position and message to the legislature regarding AB 251.
And John, the other thing is we don't need to direct anything if any of the board members just want to, be aware of what things are going on out there. The exchange does not have to take a position on any of these.
Correct.
So with that, I'd just ask board members if they have any comments regarding 251. All right, let's move on to 267 then.
Assembly Bill 267 requires that certain legal notices that are required to be published in the newspaper or on a website be published in a newspaper or on the newspaper's website for 104 consecutive weeks. I don't think, based on the discussions with the sponsor of the bill, it does not appear that was the intent. The intent was to say that if a public notice is required to be in the newspaper, that it can be published online instead, if that makes sense. The 104-week requirement was not supposed to be that it has to be published for 104 weeks, but rather that the newspaper in which that notice is published has to be in business for 104 weeks before it can be considered a valid newspaper. But the drafting got sideways, and because of the way it was drafted, we had to submit a fiscal note of almost $800,000 per year. We contacted the sponsor and discussed it. We submitted a letter that was attached to this agenda item to Assemblywoman Spiegel and to the chair of the committee that heard this bill the other day. and the sponsor was thankful for the amendment. The amendment that we recommended would eliminate our fiscal note, and once that fiscal note is eliminated, I don't think it's necessary that the exchange track that bill anymore, but until that is eliminated, we will be tracking it just in case. The issue was that the way they expanded the definition of a legal notice was that it included a legal notice that's required to be published in the newspaper or on a website pursuant to any law. And since we are required to publish agendas for our board meeting on our website, then that would mean we would also have to post our agendas on a newspaper for 104 weeks. So based on the 1 week publication of our RFA, we multiplied that by 42 because we had, we multiplied it by 12. For our expectation of the number of board meetings in future years. We hope 12 is a good number because 42 that we had last year was exhausting. But if it were in place last year, I think it would have cost us over $2.5 million. So it was pretty outrageous. Again, the amendment should eliminate that fiscal note, and so there's, assuming that amendment goes through, there should be no problem with this bill. I would be concerned, though, that if the amendment is not included and the bill goes forward, that we would have to raise our fees in order to recoup that $2.5 million, so approximately a 10% raise in our fees to accommodate this requirement.
All right, do we have any questions from board members? All right, let's move along to 369.
Assembly Bill 369 revises provisions relating to the coverage for autism spectrum disorders and certain policies of health insurance and health care plans. There are 3 bills that we're tracking that are health insurance service oriented. One is the acupuncture bill that we discussed at the last time. There's this one, and then there is one on orally administered chemotherapy. So the concern is that Nevada Essential Health Benefits have been established by CMS. If a state mandate is implemented that expands the mandated coverage beyond the essential health benefits, the state will have to pay for the amount of the advanced premium tax credit that is applicable to the amount of the premium that is applicable to the cost of the increase in coverage. So if let's say that there's an increase in cost of $1 million, and that raises the premiums within the exchange for our subsidized population of $1 million, then the state would have to pay for that $1 million cost. We are building our systems to allow us to pay that, to allow the system to be able to segregate those premiums, so that there is a portion of the premium paid by the advanced premium tax credit from the feds, a portion paid by the individual, and if there's a state mandate, a portion paid for by the state. We have not created a mechanism to get that money from the state general fund, but the concern, of course, is if there is a mandate such as this, it could create a fiscal impact. This one is under review. We're working on this with the Division of Insurance. It appears that this will create an additional state mandate, but we are not sure yet. We are pretty confident it will increase premium costs, but again, not sure if it increases if it creates a state mandate that the state has to pay for. On the autism one, the Division of Insurance submitted on the acupuncture bill, we'll talk about briefly later. The Division of Insurance submitted a fiscal note with that one, and that we are confident creates a new state mandate that would have to be paid for by the state. Again, we've built our systems to be able to accommodate that should it happen, but that would create a mandate. This one, we're not sure, but we think it will, but we don't know what the dollar amount is yet. And then the orally administered chemotherapy drugs, we are fairly confident that it won't, and we'll get to that one in a second. But all 3 of these have that same issue. That there's 2 issues. Number one, the effective dates are too early to be able to give carriers enough time to properly implement the requirement for the 2014 plan year. And for that one, because the carriers are are going to start submitting plans with imminently, within the next few weeks, next month or so, probably in May, then for a January 1st, 2014 start date, and this bill doesn't get finalized, signed, enacted until June, then the carriers may have to go back, fix their plans, potentially change the rates. It would impact our implementation and the plans that are on the exchange. It would be much easier to implement if it were effective January 1st of 2015, or perhaps for plan years beginning on or after, say, July 1st of 2014, to give carriers, plans, the DOI, the exchange time to implement this would be preferable. And again, the second item is, of course, that whether or not the state general fund will have to pay for a fund to pay or fund a portion of the APTC attributable to the portion of the premium based on the cost of the expanded benefits. With that, I'll be happy to take any questions.
All right, I'll open it up for discussion. Any of the board members have? John, I guess you're working with a division of insurance on this?
Yes.
Okay, and you will be producing a financial impact?
The division of insurance will produce the fiscal impact statement.
Okay.
And
my
then,
only comment to you would be that I think that the legislature should know the timing difficulties for the insurance companies. I mean, if the legislature feels that this needs to pass, I think that putting maybe a different start date on it would be helpful for us in the first year. I don't know how the other members feel. Do we have other members there? We're not hearing anything.
Ron Klein, I agree with you. Delaying the start date would make sense.
so on the acupuncture bill, the board voted to take a neutral position, but that to provide to the committee that here's the bill that we are concerned about the effective date being too early, and to make the committee, excuse me, and the legislature aware of the general fund cost to fund the advanced premium tax credit, and perhaps that might be a good position to take since it is a similar type of bill.
Okay, I guess we need a motion on that, don't we, John?
That would be helpful, yes.
Okay. Dr. Klein, would you be willing to make a motion to that?
Sure. I'm sorry, I'm having a little bit of trouble. I'm in a noisy environment, but yes, I would make a motion that we I think continue to take no position on the bill, but to convey our concerns to the sponsor that a delayed start date would be helpful. If I understood, am I phrasing that appropriately?
That and the impact to the general fund.
And the impact to the general fund, yes.
This is Dr. Ford. I second.
All right, thank you, Dr. Ford and Dr. Klein. All those in favor of the motion?
Aye.
I only heard one aye.
Would you like me to take a roll call vote?
Yeah, one
Aye. Klein, aye.
And
okay, Dr. Klein, aye. I think that was Dr. Ford that said aye.
Dr. Ford, aye, yes.
Okay.
Ms. Kerr?
Aye.
And then Ms. Lewis.
I don't think Ms. Lewis is on. It's just the four of you.
Oh, okay. And chair votes aye.
Okay. So I don't know if there's a difference between no position and neutral position.
I think we take no position on it and just do the effective date, just to bring everybody up to speed on the timing of what the insurance companies are doing now for our first year. And if there's any general fund impact, DOI is doing that, aren't they?
Correct.
Okay. I think take no position is than saying a neutral position.
Okay. Assembly Bill 385, we thought it had an impact when we first pulled it up, wanted to make sure it was agendized in case it did. We determined it didn't. So there's no reason to discuss that one. So if you don't mind, I'll move on to the Senate bills.
That's fine.
Senate Bill 156 requires the cover of acupuncture treatments. There has been no change in the status of this bill since we discussed it at the last meeting. The board's position was a neutral position, similar to the autism bill we just discussed, to convey the concern about the effective date being too early and the general fund cost to the APTC. And unless there are any further questions on that one, I'll move on to the next bill.
Are there any questions?
I'm sorry, John. I apologize. I'm just getting and trying to follow a noisy environment. Is this concerning the oral chemotherapy bill, or is this concerning something else? I'm sorry.
This was the acupuncture bill.
Okay, I'm sorry.
So, Dr. Klein, you don't have any questions on this bill? The status is the same.
No. When you talk about the oral chemotherapy bill, I will. But no. Sorry, I'll go back on mute.
All right, then let's move on to Senate Bill 266.
Which is the oral chemotherapy bill. Same exact comments as the acupuncture and the autism bill. However, it appears that there will be no fiscal impact to this bill. So we took a look at it. It appears to be a bill of parity. The chemotherapy services are currently covered. Additionally, in the essential health benefits, additionally, the essential health benefit rules require that each formulary offered in the small group and individual market beginning in 2014 include at least one drug in each category and class. Include at least one drug in each category and class of the U.S. Pharmacopoeia Model 5.0 guidelines. So it appears that this has to be covered anyways. There are some cost-sharing requirements, but the essential health benefit does not discuss that. So the mandate requirements that the state would have to pay for a given piece of coverage does not apply to cost-sharing, but rather to the benefits that are covered. Therefore, we are fairly confident that there is no fiscal impact on this bill. The Division of Insurance has asked CSIO for a stance on this, and they have said verbally that, no, we don't think that there's a fiscal impact, but they won't put it in writing either. And so that makes us a little concerned that we can't get that assurance, but it's the best information that we have currently. So right now, our concerns remain the effective date of October 1st, 2013, and whether or not that will give carriers enough time to properly implement the requirement for the 2014 plan year. I don't know what would happen. Again, carriers are starting to implement this now. If it's a cost savings, it shouldn't be a big deal, but if it's a cost, it could increase premium. Either way, you'd want to have premiums that match the rates properly. And this is not to say that we don't think that that orally administered chemotherapy drugs should be covered, but to implement this for plans that have not already done so may be difficult given our current timelines, and it might be appropriate to request a later effective date. And with that, I'll be happy to answer any questions.
Dr. Klein,
I mean, my only statement here, and I'm speaking as an uncomfortable, not as a Health Insurance Exchange Board member, I think this is a very, very important issue for people in the state. I think there are many people who are facing financial difficulty because they're unable to pay for oral chemotherapy as more and more chemotherapy. This is a new issue because it's only been in the last 10 years or so that chemotherapy has become oral rather than IV. So I think this is a tremendously important issue for people, and I would actually even push the insurance companies and I think implementing this legislation as soon as possible is important. So I might even oppose that concern about timelines. I think it's just so to people to get this in place.
John, since there's not at least your understanding of it, that there wouldn't be a financial impact on this. Is there a problem with the effective date?
I don't know. I guess we could query the carriers and find out which ones don't do this already. On the other hand, I wouldn't be surprised if they expect it to pass and they set it up. You know, sometimes you set up your business expecting the passage of a certain bill. Certainly, we did that going forward with the exchange and through all the Supreme Court decision. So I wouldn't be surprised if the carriers that don't offer it are already trying to make sure it happens, especially because there is no fiscal impact to the state. It is much more likely to pass than the other two bills that are likely to cause a fiscal impact. So they may be implementing already anyways.
I think you made a good point, John.
Dr. Klein, do you want me to open this up for public comment and see if any of the phone participants might answer that for us?
At your pleasure, Madam Chair.
Okay, Dennis, is that appropriate for us to do that?
Certainly, you can open it to public comment.
Okay. I'm going to open it up for public comment if any of the carriers are on the line and might address that question. Doesn't sound like we have it then.
I think everybody that was that has a say in this was at the legislative hearing earlier today and may not have made it over yet. We have public comment here in Carson City.
Well, I just want to let...
Can you please say your name for the record?
Kurt Stembridge, GlaxoSmithKline. I'm a lobbyist for them. During committee...
You need to get closer to the phone. It's very hard to hear you.
We're bringing him up here.
Kurt Stembridge, GlaxoSmithKline, State Government Affairs. In committee, the carriers did ask for an amendment, and I think they're looking at that right now.
For
the start
for
date.
the timeline.
Correct. That's where I just came from.
So
It may be too early for us to take a position on effective date then.
Well, if that position has already been conveyed by other members of the public to the legislature, that concern is already out there. So it may not be necessary for us to bring that forward. Because there's no fiscal impact, I'd be less inclined to be concerned about offering a position on this bill and let the legislative process play out.
So let me move that we take no position on this bill at this time. That's appropriate.
You know what, Dr. Klein? We haven't taken a position on any of the others. If we've asked questions or...
Okay.
Why don't we just listen to this discussion and move on to the next bill? I think it's more appropriate that we have motions, things that we're directing staff to do something.
Okay, I agree.
Okay, thank you.
We have a motion.
With that, John, then just keep us posted on that one, and we'll move on to SB 318.
Okay, Senate Bill 318 requires the Legislative Committee on Healthcare to conduct an interim study concerning claims, coverage, and payment under policies of dental and health insurance. There is no fiscal impact to the exchange, though we do expect that this interim study will study a lot of the things that we put in place here and the things that the carriers put in place on our exchange. I simply wanted to bring this to the board's attention that this bill is out there, and it could require some work by staff, but there's no fiscal impact, and we have no recommendation at this time for Senate Bill 318.
All right, do we have any questions from members? If not, let's move on to 352.
Senate Bill 352 revises the makeup of the board of the exchange. This bill increases the number of voting members from 7 to 9, and so the 5 appointed members by the governor would increase to 7. The bill eliminates the prohibition of an insurance carrier or affiliate being part of the board, so it would allow an insurance carrier to be part of the board. And it also allows an individual who is part of a who has experience in a large group market to be part of the board. That piece of it is kind of odd because we don't. The shop exchange is only available to the small group market. I have reached out to the sponsor. I have not yet been able to meet with him regarding the bill or the individuals that are working through it with him. So at this point, I don't have anything to provide to the board on any kind of progress that we've made to understand it better. Hopefully, I'll be able to provide some better background at the next meeting.
All right. Do we have any questions? And let's move on to 3.
Oh, I'm sorry, it's a wrong line. John, just really quickly, who was the sponsor of this bill?
The sponsor of the bill was Senator Hutchison.
Okay, thank you.
All right. If there aren't any other questions, we'll move on to 359.
Senate Bill 359 requires the exchange to direct marketing for qualified health plans primarily to employers that do not provide for or offer health insurance to their employees. There were a couple of concerns with this. One of them is that it completely leaves out the fact that 115,000 out of 118,000 of our participants are going to be individuals. In discussing this with the sponsor and the lobbyists that have been working with this bill, the intent was not to direct it to small employers, but to ensure all the stakeholders that we are not specifically going after the business of those employers that are offering insurance. And I think it's having been neck deep in this for a year and reviewing our statute and reviewing our strategic plan and all the discussions that we have. Our mandate is to reduce the uninsured in Nevada and make available tax credits. So I don't think that we have tried to go after other business, but there's a lot of misinformation out there. We certainly want to make sure that small employers that don't offer coverage can get coverage on the exchange, and that small employers that want to access the tax credit can do so. We also want to make sure that those individuals that are uninsured have a place to go to get insurance as well. So we've been working with the sponsor of this bill and their constituents on this one, and we've come up with some alterations to that language that basically includes directing that marketing to the uninsured and underinsured individuals. And with the Deputy Attorney General's review of that language, we've also added what was the language? As feasible or something to that effect, to the extent feasible. With those amendments, and assuming the sponsor is comfortable with that, we are comfortable here at the staff level in supporting that amendment to make sure that everybody's clear that we are not trying to put anybody out of business. We're not trying to compete with anybody. That we want to make sure that we follow our mandate and ensure that people are insured in Nevada.
Just for a little bit of background for the other board members, John and I have both been working on this, and there's been a very unfortunate perception that the exchange may become predatory to those brokers and agents that have existing clients, and that is not the case. We want to keep the insurance industry healthy here. We're not trying to compete with them. And I think this offers some sort of comfort level to those people that have concerns. John, I did get a call from their lobbyist about 10 minutes before we started the meeting. Everybody's on board with your suggested language, and the bill drafter has looked at it, and they feel it's acceptable too. So with that, I would suggest that the board support the changes that John has worked on with industry on this. any of the board members willing to support the suggested language that appears right now to be supported by all the parties?
John, can you repeat that language again? I'm sorry. I'm trying to listen and drive. All of it interesting.
So the language is that. Give me just a second. It's to the extent feasible, or it's the exchange shall, to the extent feasible, direct marketing for qualified health plans primarily to uninsured and underinsured qualified individuals and qualified small employers that do not provide or offer health insurance to their employees. And I apologize for not having that.
This is Dr. Ford. I would. Do you need me to have a motion?
Yes, please.
This is Dr. Ford. I so move to support the language previously noted.
Okay, thank you. Do we have a second to that?
Ron Klein, I will second.
Thank you. Thank you, Dr. Ford and Dr. Klein again. All those, well, let's see, we're going to do roll call. Ms. Kerr, how do you vote?
Aye.
Dr. Ford?
Aye.
Dr. Klein?
Aye.
Chair votes aye. The motion passed. All right, SB 418.
There's been no change to Senate Bill 418 since the last meeting. And with that, I'd be happy to move on to the next bill.
Okay.
The next bill, it is written in here as BDR 1344, which is how we entered it into NEBS. It came out of draft as BDR 571156, and it is now Assembly Bill 425. So, so Assembly Bill 425, as it will be going forward here on out, is the Division of Insurance Omnibus Bill. It allows the Division of Insurance to certify navigators, enrollment assisters, and certified application counselors. It aligns state law with the Affordable Care Act and allows the Division of Insurance to ensure insurance networks meet minimum adequacy standards. Since we provided the bill, or since the Division of Insurance provided the bill, there have been several areas where the Division of Insurance would like to amend, and staff agrees with those amendments, but I don't have them all here right now. One of the things that happened since that bill was submitted is the federal requirement to include certified application counselors. So we have to expand the bill to include certified application counselors. And I believe we need to expand the scope of the network adequacy provisions from HMO to the entire market. But I think that we have, so far we've moved forward in that manner. None of the stuff that we're adding, I don't think it's news to the board. I think we've discussed it in the policies that we've had so far. And so in any event, we will provide more information once we have that exact wording for the bill. I would also like to point out, I think that the bill as submitted was 40 pages. As it was introduced, it was 60 pages. So we have some work to do to go through it and figure out what all is in there. Theoretically, when the bills come out of draft from an agency, they're supposed to keep with the intent from the agency. I would imagine that the Division of Insurance, if the governor's office had some change to it, they would have worked with them. Although I don't imagine that there was any change to it. When we get to our bill, you'll see significant changes to it. It still stays within the intent of what we wanted, but is significantly wordier than how we submitted it. As long as it does the job, it is fine by me. So with the Division of Insurance one, we hope to have some updates for the board on the actual amendments, and we again need time to go through the entire bill to see what actually happened in it.
John, with Ron Klein, I may have been lost a little bit on the details, but doesn't federal law, doesn't federal law require that, I know we outsourced, for lack of a better term, certification of navigators to the Division of Insurance, but doesn't federal law require that the exchanges have control over that function?
The federal law requires that navigators be certified. I do not recall at this point whether they're required to be certified by the exchange. They do have to have agreements in place to be certified.
The exchange has the ability to certify.
So Mr. Bowden says that the exchange has the ability to certify. I'm not sure if the exchange is required to do it or simply that they're required to be certified. The difficulty that we ran into, this was with the Consumer Assistance Committee, was that there is a statute in place that says that only licensed producers can enroll people in health insurance, that anybody else would get fined for it. Now, the federal law says that navigators will facilitate enrollment, but the line between facilitate enrollment and actual enrolling somebody is a very difficult line to draw. We're not sure exactly where that goes. Does it mean that they get them through the application process and say, shop and compare, you're on your own? Does it get them through the shop and compare process and say, but I can't touch the button? Or do they get to touch the button that says enroll? By allowing the Division of Insurance, by adding a new chapter in NRS that creates a certification for exchange enrollment facilitators, we get around that, allow that to happen so that there's no fine, finessing of the language. They can, in fact, enroll people in insurance, and so that will make it much cleaner if this legislation goes through.
Yeah, I have no opposition to it per se. I'm not sure if federal law requires that we maintain that authority. I mean, if it does, obviously federal law would supersede state law, and so the state law would become moot. But I just needed a clarification on that.
Okay. So we don't have to take any action on this till you really are able to come, analyze 60 pages. Correct, John?
Correct. And so if this bill goes before a committee prior to the board being able to take action, it would be my intent to say that the exchange needs this bill to go forward so that we can certify navigators, enrollment assisters, and certified application counselors, align the state law with the Affordable Care Act, and to ensure that network adequacy standards are applied to the entire market. I don't know if it's a fine line between supporting the bill and indicating that we need it to go forward, but we need it to go forward. So I'm not sure exactly how you would like me to proceed.
Well, we certainly want to support having this pass.
Well, in a sense, I have no problem supporting it because, to be honest, if I understand law correctly, if this law clashes with federal law trumps state law. So if I'm correct and we have to have that authority, then no matter what the state law says, we have that authority. If I understand correctly.
Correct. If this law does not go through, we will have to the exchange will have to certify navigators, and we will have to draw that very fine line between facilitate enrollment and actually enrolling people. We could do that. It's a difficult discussion, but we have a can-do attitude over here.
But doesn't the federal government allow us to delegate this authority to the Division of Insurance? I guess I'm not trying to be difficult. I'm just trying to understand where, if I understand correctly, the state law takes away this authority from the exchange. And my only question is, doesn't the federal law require us to have that authority? It's something we can delegate, but ultimately we have to have that authority, if I understand correct.
I'd have to look at it at the law again. It's been a while since I've looked at it, but I think that it it says an exchange shall certify. We can delegate that to the appropriate agency. The recommendations of the Consumer Assistance Advisory Committee and the board, based on the plan for navigators, enrollment assisters, and certified application counselors that has been approved by the board, indicates that we will have the Division of Insurance certify those entities to make sure that our consumers are protected. That is the Division of Insurance has historically taken on a consumer protection role for individuals in the insurance market, and so I think that was the intent of the board when that plan was approved.
Well, John, I think without a doubt, Division of Insurance has been our partner all the way along this way. If this is the language that they feel that they need in order to support us with this, then we should have a motion to support so that you can do that publicly in front of the legislature.
Now, one thing that I just remembered that I need to point out, and this might create a whole nother discussion, but the bill, excuse me, has a provision in it to charge an application fee. Currently, producers are charged an application fee, and I think this mirrors that application fee. I believe that fee is $195. There are also going to be education requirements. My understanding is a 20-hour course currently costs about $250, sometimes a little bit less. Additionally, there's a testing requirement and a background check requirement. Now, all of the requirements were included in the plan for Navigators Assisters and Enrollment Sisters in CACs, but the dollar amounts were not. The total amount we think is about $550. We provided that information to the legislature this morning at our budget hearing. At the orientation meetings for the request for application for grants for Navigators and Enrollment Assisters, we indicated that amount of about $550 to $600 could be included in the grant application so that they could be reimbursed for each individual for that amount. So the exchange intends to pay that amount for that individual. It would not be paid for a certified application counselor. They would have to do that separately. So they'd have to use their own funds or their organization's funds to do that. But if a navigator or enrollment assister applicant requests that money and we approve their grant, that would be included in their grant.
So you're trying to make this as economically feasible as possible for people that apply, right?
Correct.
Okay. Do we have someone that wants to make a motion to support this?
Marie for a motion to support.
Thank you, Marie. Is there a second?
This is Dr. Ford, I second.
Thank you, Dr. Ford. Let me do the roll call again. Dr. Klein, how do you vote?
Aye.
Dr. Ford?
Aye.
Ms. Kerr?
Aye.
Chair votes aye. Motion passes. Let's move on to the bill that the Health Insurance Exchange put together.
So this one was BDR 1285 when we submitted it. It was released as BDR 571167, and now it is Senate Bill 454, and this is on the bottom of page 9. The bill does basically four things. It retains interest earned on the exchange reserves. It exempts fees charged by the exchange from the premium tax. It authorizes the exchange to offer supplemental products, and it corrects various housekeeping items. So on this bill, Section 2 allows us to retain the interest. Section 3 exempts the fees charged to the carrier by the premium tax. Section 4 was actually written, Section 4 allows us to offer supplemental products. Section 5 clarifies that at least one appointment by the governor must be one appointment by the governor must have experience as a consumer or consumer advocate, and that requirement is in federal regulation that at least one board member have experience as a consumer or consumer advocate. So this bill simply makes it a hard requirement that one of the governor's appointees must have that requirement. Section 6 of the bill talks about removal, and actually I think Section 6 is not required. I think that the drafter of the bill thought that if we had nobody on the board that satisfied the consumer advocate requirement, that the governor may remove a member of the board to allow him to appoint somebody that's a consumer advocate. It turns out that multiple people on the board are consumer advocates. Going forward, if there's only one person that's a consumer advocate and that person is no longer a board member, then the governor would have to replace that person with a consumer advocate to make sure that at least one person is a consumer advocate. So I don't think Section 6 is required. Section 7 allows the director to submit reports, or basically every report that the exchange provides is required to be submitted by the board. I think that will be difficult when we are submitting daily files to the feds, daily reports. And so the language that you ensure that the reports are submitted as required helps us to make sure that that is correct. And then Section 9 repeals two definitions that are not used anywhere else in the statute. So the two amendments that I would like to propose, number one, to delete Section 6, because we already have consumer advocate members on the board. I don't think that is required, and going forward it would not be required. The second amendment that I'd like to make is to Section 4. The board has indicated that it feels that dental and vision benefits are a part of a person's health and that they should be offered in the exchange, whether those are pediatric or adult. There is the word pediatric at the bottom of the amended language on Section 4. I believe it's Section 4, subsection 2, paragraph C. The last part there says that contracts or policies with which the exchange may offer pursuant to this paragraph include, without limitation, contracts or policies providing pediatric dental benefits or vision benefits. There's two problems with the addition of pediatric. It appears that pediatric may or may not apply to vision benefits. And as we've had this discussion in the past, the qualified health plans are required to include vision benefits in their plan. So the intent of the board was to offer dental vision benefits, adult vision benefits, and then additionally, the board intended to offer both pediatric and adult dental benefits. So the recommendation that I would have to amend this section is to strike the word pediatric. So again, two amendments I'd recommend. One is to strike the word pediatric, and two is to delete Section 6. One additional item of concern that has come up, there has been a lot of concern from, I think it's from the broker community, about the flexibility afforded to the exchange in this paragraph that allows the exchange to offer products which are supplemental to a qualified health plan and related to the qualified individual's qualified health plan or other benefit provided by the qualified individual's employer. The concern that has been raised is that gives us basically no boundaries on what we can offer, or very few boundaries. There's concern that we are competing with the brokers out there. When somebody brings that to my attention, first of all, I understand their concerns, but I would like to point out that we have been very accommodating to brokers, and in fact, brokers that are offering products on the exchange will get their commissions just like they're getting in any other place outside the exchange. And I realize we're coming up on 5 o'clock, so I'm almost done. So that's part of it. The other thing that could happen is that might make this more comfortable for people is to put some kind of box around it, whether it's requiring us to go to the Interim Finance Committee for approval, or requiring a certain number of publicly noticed meetings notice to certain organizations about this, or a delay in the implementation. The intent of including this flexible language is to allow us to potentially offer a product such as perhaps a health savings account or health reimbursement arrangement that might go well with these products, perhaps in 2015. If there is no allowance for this, we will not have the authority to do so and would not be able to do so until after the 2015 session, which means that it would be, as early as we could possibly do it, would be the calendar year 2016. So this allows us to be flexible in the implementation to make sure that we provide products that are appropriate for Nevada's consumers. Again, this is not intended to compete with anybody, although I understand that there's that perception, and so we would be happy to entertain any amendment that would help Nevadans feel more comfortable with this flexibility that we are afforded.
All right, do we have any comments from board members? Then we need a motion to accept the changes that John has suggested to Section 4 and Section 6, and deleting Section 6. Do we have a board member who's willing to make that motion?
Marie Kerr, motion.
Thank you. Do we have a second?
Ron Klein, I will second.
Okay, thank you. Dr. Ford, how do you vote?
I vote aye.
Dr. Klein?
Aye.
Ms. Kerr?
Aye.
The chair votes aye. Motion passes. All right, so that rounds up all of our discussion on Senate and Assembly bills. Do we have any members that want to bring any other further action items or dates for agenda items in the next meetings that we have? Sounds like we don't, so let's move into public comment. Do we have anyone that wants to participate in public comment during the meeting? If there is, please identify yourself for the record. Okay, sounds like there's not. I think we've covered everything, haven't we, John?
Yes, ma'am.
Okay, with that then, I'm going to adjourn the meeting and thank everyone for joining us today, and thank the board members for cooperation and accommodating a late day conference call. So good evening, everyone, and thank you for being here.
Thank you.
What'd you say, 100 more bills this week?
180, I think.
We need to schedule an hour and a half.
John, Kurt Stenbridge,
How are you?
GlaxoSmithKline. How are you?
Good.
You go to my cards.
Oh, sure.
Exchange is like #1 thing for a company now, and I'm
Yeah.
like, oh, been way involved in Nevada, but
Yeah.
a lot of questions coming out of other states about you guys, especially Idaho. I lobby in Idaho. They just passed their health exchange bill last week.
We, I had a day-long meeting with Bill Deal, who's
Oh,
their
good. Yeah,
director
I know
of
Bill real
insurance.
well.
Yeah. Talking about all the things that we're doing here and how I would do it differently there.
Okay.
Because they only have a much shorter runway than we had.
Yeah.
So they need to give somebody the authority to just run with it. And basically, I think that their board, whatever policy decision their boards make, should not be for October 1st. It should be October 15th of 2014.
Yeah.
For year 2, and they should